Hello all, myself Dr. Sureka, lecturer, Department of Biochemistry, SRM Dental College, Ramapuram. Today I am going to discuss on the topic vitamin B5, which is otherwise called as pantothenic acid, and vitamin B7, biotin. So in this lecture, I will be taking the structure, active forms, sources, biochemical functions and deficiency manifestations of these two vitamins. Pantothenic acid, vitamin B5, is otherwise called as chick antidermatitis factor. Here is the structure of pantothenic acid where it has got pentoic acid chain attached to the beta alanine via peptide linkage. Pentoic acid is nothing but alpha hydroxy acid.
The active form of pantothenic acid is coenzyme A and acyl carrier protein. These two active forms they do possess SH terminal SH group. Here in coenzyme A they have mentioned COA SH. Similarly, the ACP which is present as one of the molecule in the fatty acid synthase complex that we have seen you already in the fatty acid synthesis. This terminal SH they act as a reactive site for the carrier of acyl group. So they usually involved in the acetylation reaction. And when you come to the sources of pantothenic acid, there are various plants and animal which are rich in pantothenic acid. And some of the sources includes eggs, cauliflower, mushroom, corn, avocado, yogurt, sweet potato, broccoli. When you come to the biochemical function, as I already told you, the two major forms of pantothenic acid always involved in the biochemical function, and one is coenzyme A, and the other one is acyl carrier protein. They do contain terminal SH group, and they act as a carrier of acyl group. And I already told you this pantothenic acid they always involved in the acetylation reaction. Here the coenzyme A involved in various reactions such as the reactions of citric acid cycle, fatty acid synthesis and its oxidation, synthesis of cholesterol, utilization of ketone bodies. Whereas your ACP, they participate exclusively only in the fatty acid synthesis. The recommended dietary allowance of pantothenic acid was not well established. However, for adults, it is advised to take 5 to 10 milligram per day. When you come to the dietary syndrome of pantothenic acid, it is not well manifested in human beings. However, one of the doctors in India, he just linked the burning feet syndrome with pantothenic acid deficiency. So the burning feet syndrome includes pain and numbness in the toes, sleeplessness and fatigue. It just linked with the pantothenic acid deficiency. So far we have seen the pantothenic acid and its structure, source, active form, biochemical function, recommended dietary elements, and deficiency syndrome, which includes burning feet syndrome. So, next we'll see the other vitamin that is biotin. Now we have come to the another vitamin biotin or vitamin B7, which is formerly called as vitamin H, and it is also called as anti-egg white injury factor because it can act against egg injury factor avidin. When you come to the structure of vitamin B7, that is biotin, it is a sulfur containing vitamin. Mostly it is involved in the carboxylation reaction. Previously, we have seen pantothenic acid, it is involved in the acetylation reaction, but this biotin always involved in the carboxylation reaction, and its structure is usually described as heterocyclic sulfur containing monocarboxylic acid. And when you come to the exact structure of biotin, it is formed by the fusion of imidazole ring and tetrahydrothiophene ring with the valeric acid side chain. Here you can see the structure of biotin where CH2, 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 the 4 CH2 and COOH indicating the valeric acid side chain which just linked to the tetrahydrothiophene ring which gets fused to the imidazole ring at the bottom. So this is the entire and full structure of biotin. When you come to the active form of biotin, biocytin is the active form of biotin. Biocytin is produced by the covalent linkage of biotin to the epsilon amino group of lysine residue of enzyme carboxylase, resulting in the production of biocytin. It is a active form of biotin. And when you come to the sources of biotin, biotin is present majorly in the animal and plant sources, and it is rich in liver, kidney, egg yolk, milk, tomato, grains, etc. It is also found to be synthesized by the intestinal bacteria or microorganisms that we discuss in the later slide. Now we have come to the biochemical functions of biotin, which involves a coenzyme of now we have come to the biochemical functions of biotin, which acts as a coenzyme of various carboxylase reactions. They do act as a carrier of carbon dioxide. As I already told you, they always involve in the carboxylation reaction. Here they have provided some of the reactions where biotin is getting involved in. First is the fatty acid synthesis, where acetyl-CoA acts as a starting material for the synthesis of fatty acid. The very first step in the fatty acid synthesis, the carboxylation reaction, where acetyl-CoA gets converted into malonyl-CoA by incorporating carbon dioxide in the presence of biotin by the enzyme acetyl-CoA carboxylase. And second is the conversion of pyruvate to oxaloacetate by the biotin dependent pyruvate carboxylase, where this is used for the synthesis of glucose from any non-carbohydrate sources. And the oxaloacetate formed is also required for the continuous operation of TCA cycle. And third is the conversion of propionyl CoA into succinyl CoA. So the metabolism of propionyl CoA formed from the many amino acids such as valine, isoleucine, threonine, and also we derive from the odd chain amino acid odd chain fatty acid oxidation. So the propionyl CoA formed will be converted into succinyl CoA by the presence of biotin, where they act as a carrier, and the enzyme involved is propionyl CoA carboxylase and gets converted into methyl malonyl CoA. This again undergo racemization mutation to form succinyl CoA. So these are all the three important reactions where biotin is getting involved in. There is one more reaction which is seen in the next slide, where the biotin enzyme, biotin as a coenzyme act in the carboxylation reaction. Now, the another important pathway where biotin acts as a carbon dioxide carrier is the catabolism of branched chain amino acid leucine. During this process, beta methyl crotonyl CoA gets converted into beta methyl glutathione CoA. This is done by the enzyme called beta methyl crotonyl CoA carboxylase. They require biotin as a carbon dioxide carrier. And also there are various other carboxylation reactions where biotin does not act as a carbon dioxide carrier. They do not require biotin for the incorporation of carbon dioxide group in the reaction, which includes in the urea cycle the carbonyl phosphate synthesis, which produces carbonyl phosphate. Here, the carboxylation reaction taking place, which is independent of biotin. The synthesis enzyme will act as a carbon dioxide carrier. Rather, it do not depend on the biotin. And also the incorporation of CO2 to other C6 in purine ring, where the purine ring formation, the carbon dioxide incorporation is done without the presence of biotin, and also the malic acid converts the pyruvate into malate independent of biotin. So all the enzymes which involved here is different. It is not a carboxylase enzyme. So which means the carboxylase enzyme only requires the biotin as the carbon dioxide carrier, where the other enzymes can also perform the carboxylation reaction independent of the biotin. When you come to the recommended dietary allowance of biotin, the daily intake of biotin for the adults was recommended to be 150 to 300 mg. And I already told you it is synthesized majorly by the intestinal microorganisms. So the dietary allowance is not highly needed because it is synthesized naturally by the intestinal organisms. So the dietary supplementation is not necessarily needed in case of biotin. When you come to the deficiency syndrome, as I told you already, it is widely distributed in all plant and animal source, and it is also highly produced by the intestinal microorganisms. So natural deficiency of biotin is not well characterized in the human beings. However, the experimental deficiency of biotin is well explained in the next slide.
The experimental biotin deficiency can lead to nausea, anorexia, glossitis, dermatitis, alopecia, depression, and muscular pain. Although the patient who are taking uncooked eggs or raw eggs, They found to show biotin deficiency because the protein avidin, which found to bind to the imidazole group of the biotin and prevents its absorption. Thereby, they show the deficiency symptoms of biotin. Also, when the patient is undergoing any antibiotics treatment, this antibiotics can inhibit the growth of the intestinal organism, thereby eliminating the source of biotin synthesis. This is where the patients will be showing the deficiency symptoms of biotin. Thank you.